right, James, we're live.
Oh, wonderful. It worked, finally.
Oh, yeah.
First time ever.
I still have my mask.
Ah,
But they said that healthcare facilities are still supposed to wear their masks.
good thing we did that today, huh?
We did, yeah.
Mhm.
Yeah. Well, for many patients, health feels like a factory feels like a factory that whitewashes problems with pills and churns out one-size-fits-all solutions with surgery. I'm Dr. Donish, native Kentuckian and the medical director of Wellward Regenerative Medicine. As a Johns Hopkins trained double board certified anesthesiologist and regenerative pain specialist, I believe it's time to revive the caring spirit of healthcare and offer you, the patient, the healing that you deserve. This 50 Shades of Pain show is one way we empower you to receive sustainable treatments for injury and pain without surgery, addictive medications, and without being a victim of a system designed to work against your body's healing. I encourage you to start your healing journey at wellwardmed.com. Today I'm with my co-host, Dr. James Escaloni, who is our physical therapist and biomechanical expert here at Wellward. Like me, he's seen firsthand countless patients who have suffered unnecessarily, not for lack of qualified caring doctors, but from a broken healthcare system. So, James, with all those flubbers, what are we talking about today?
We're going to be talking about lumbar fusions, and especially lumbar fusions that didn't help the patients like they were supposed to. So, for you out there in internet world, Facebook world, Instagram world, and all of the above, I want to talk to you about this. Do you or one of your loved ones, have you been told that you've got degenerative disc disease and you had a fusion to prevent it from getting worse? Or maybe you had that fusion and it helped out, my leg pain feels better, but gosh, I've had this persistent back pain for years. And they said that all they could do was another fusion. What about one of your loved ones? They had some trauma, maybe some car wreck, and the bones were broken. They fused it together, but they've been in persistent pain since then. If any of those are sticking around, any of those talking to you right now, this show is for you. All right, so Dr. Donish, we need some help right here for our friends out there in internet world. What exactly is a lumbar fusion?
So, this is a skeleton of a spine. It's not real, James. Don't worry. Whew. You can see that there's a lot of different joints in the body, and this spine has two major curvatures. This guy's kind of probably not doing so well, so I'm going to curve his spine a little bit like this and like that. That is more of like a normal configuration of somebody's spine. And the reason that it has this S shape to it is because this acts as a shock absorber. So as you're walking around, moving around the world, your spine is flexible and it's adjusting. Every time you walk, you'll notice that, somebody who's walking with a stiff spine just kind of walks like this, versus a normal person is going to walk like kind of,
A little more groove into their step.
yeah, like that.
Mm-hmm.
So, and the reason that's important is because if our body was completely reliant on the discs as the main shock absorbers of the body, of the spine, you can understand why they would wear out very quickly over time, because discs are, every cartilage part of your body has a very limited supply of circulation and oxygen, because frankly, that amount of movement and pressure in a structure that's meant to take so much stress would periodically block off the blood vessel there. So it's almost like that structure needs to be able to endure periods of low oxygen. And because of that, it's not going to have the same resiliency as like a muscle or a tendon would, where if you injure it, which you do with exercise, every time you exercise, you're injuring a muscle to make it grow bigger. Because a disc doesn't have that kind of circulation, it doesn't have the capacity for injury. So the curvatures of the spine are meant to create this bouncy, springy-like structure in your body to absorb that injury or that constant pounding. Now, as we age, just as how our skin gets wrinkly, our joints will also get wrinkly as well. And that wrinkling is essentially the loss of stability or integrity in the body. And if you can imagine within the spine, if I have all of these little segments and joints that have ligaments stabilizing them, and over time they become wrinkly, you can imagine that sometimes it's going to have a little bit too much give to it, a little bit too much forward and backward. And that forward and backward is kind of the starting process to why people develop degenerative discs. It's that one segment starts to lose its integrity, the muscle that runs up and down the spine tries to brace that by tightening up. And what that essentially does is it changes the configuration of this column. Instead of it being like a spring, it ends up being like a hinge, where if all of these muscles are really, really tight because they're trying to protect the forward and backwards motion of this segment, then everything is going to start to hinge at that lowest joint, this one down here, for instance, hypothetically speaking. Or since there's a bulging disc or a herniated disc on this one, you can imagine if like these segments are unstable or these segments are unstable, then this is all going to become stiff because of the muscles trying to control that forward and back movement. So everything hinges off of that, and it causes a faster degeneration in that disc than of the other structures, the other discs in the body. That essentially is degenerative disc disease. It's the loss of ligamentous stability in the body, where the body tries to compensate, but in doing so, it's actually making things worse.
So basically, people should be walking around with a little bit more of this S right here. And what happens over time is they start to lose a little bit of that S. And that makes it so instead of that S, wherever it straightens out, that tissue, it's not bouncing well, it's kind of shearing. And that's when it causes some problems at that shearing spot, right?
Right. So like, for instance, if this area is stiff, then this area, your body is hinging off of this one spot instead of distributing it among 5 or 6 different segments. So this spot is now going to get a tremendous amount of load going both forward and backward, as well as sliding forward and backward. A disc is really good at compressive forces, but it's terrible at shear stresses, meaning like if I put pressure on this spine and I push downwards, even without that kind of S configuration, a disc does a reasonably good job of taking that stress. But if I were to now push the spine forward or backwards, that's a really difficult stress for that disc to take. And it will, essentially a disc is like a jelly donut where you've got multiple rings surrounding a jelly center. And if you press on that, you're not gonna rupture that jelly donut. But if now you scoot it across the table where the bottom is sticking to the table and the top is kind of loose, it's going to shear that disc open. Or if, for instance, I come in, take a bite out of that jelly donut, and now I try to compress it or try to push it, all that jelly in the donut is going to squirt out and become really toxic and irritating to the nerves in the back.
So, a couple big points that I want to make sure I got. One, don't stick around you if my back's looking like a jelly donut.
Make sure I got it. He teaches me this stuff every day.
Yeah. All right, so the second part, in addition to avoiding him if he's hungry for that jelly donut, once that starts to break down and you start to get that degenerative disc disease on a spine, if you start to get pain there and you see the surgeon, then they're probably thinking a fusion for you, right?
Right.
Because they're going to stop that sliding motion.
And it makes sense because once that degenerative process starts, it snowballs out of control. Because when the disc becomes irritated, it starts squishing its jelly donut back into the spinal canal, which is this area here. That's going to affect all of these nerves that go out. The body goes into this defensive reaction where it's going to trigger those muscles to grip even tighter, which accelerates the problem even further. So it just kind of spirals out of control. So historically, the thinking was if we can get ahead of this and fuse this person's spine, then this whole snowballing effect is not going to keep going and it's not going to accelerate. But this is where you come in.
You stole my line there. I was supposed to say, but hold on a second. But why is it that they still have pain after that amazing sounding surgery?
It's because when they fuse one segment, so a lot of people have heard of people where they get, one fusion, and then a few years later they have to go in for a second fusion, they have to go in for a third, and it just kind of keeps going. It's because they're not really fixing the problem. They're stabilizing it temporarily, but by stabilizing it, they're amplifying the same reaction that caused the degeneration in the first place. So, for instance, you've got 5 lumbar vertebrae. These are the ones that are most commonly fused, and the cervical. Thoracic has the chest, the ribs coming out, so it's a little bit more stable. So lumbar and cervical tend to be the ones that need the most support. But let's say, for instance, you've got a hinging joint at L5, meaning spine is wobbling like this. And a surgeon comes in and fuses this segment, L5, focus, there you go. All right, so let's say a surgeon comes and fuses L5 to the sacrum. Well, this segment is now secure, but now you've got that hinging taking place one segment above. So everything that caused that L5 to degenerate is now putting pressure on L4 to degenerate. And you're going to start to get that wobble going at another segment, and that segment starts to deteriorate. So it's a reasonable solution, but not necessarily a long-term solution.
Okay. Well, so here's some important questions. Why is it that if this thing that makes sense and they get that surgery and it stops that motion from going on, why is it that their back still hurts afterwards?
A lot of reasons for that. It's not an easy answer. One is you can get adjacent level disease, meaning the segment above or below can now be seeing excessive stress and start breaking down. But I think one of the bigger reasons is, we think of surgery as this magical event that suddenly what's broken on the inside is mended. But imagine what structures we have to go through just to simply get down to this level. There are muscles that line up and down this area, and these muscles are very, very delicately coordinated. Like, the muscles will feed off of each other and work as a group to figure out what movements are needed within them to create the movements your body's trying to create. Like, everybody has seen belly dancers or hula hoop, and I always find that impressive. I've never, ever been able to do a hula hoop. And I'm not bad. I mean, I can belly dance, James. But I've never
that's the next episode.
The next episode, I'll be belly dancing. But those movements are very coordinated, and they need feedback from each other to get there. Even the slightest amount of surgery is going to have to cut through those muscles, and the scarring that creates will throw off the balance of that whole system. Now, rehab, physical therapy, and different treatments that we can do that will break up some of that scar can help, but it would be fantastic if there were solutions that didn't necessitate cutting any muscles or disrupting the muscle bed. It's not just the muscles either, because the ligaments that run along here are often distorted as well during surgery, and ligaments we know are notoriously difficult to heal after they've been injured. They have really limited blood supply. They are very difficult to exercise and stress in a way that gets them stronger. So when a ligament is damaged, everything around that ligament has to compensate for it, which means that they're not going to be working the way they were designed to work. Going back to that whole scenario where you've got a hinging joint that's putting stress on a level that's not used to seeing that amount of stress.
Do those injured ligaments show up on that MRI when people are looking for degenerative disc disease?
Yeah, that's the thing is ligaments have been the stepchild of all of orthopedics and pain management, because it's very hard to get a good view of a ligament since they often go in direction. So when I take an MRI, or when I look at an MRI, essentially I'm looking at a sheet of paper. I'm taking a three-dimensional structure and I'm looking at just one sheet of paper of it. So like, for instance, an MRI would be just like one slice through this way, one slice through this way, or one slice through this way. And you can imagine that the ligaments in the body are not going to be aligned with this plane. So they're going to be going, crooked or going in and out of the plane of the image. So to be able to look at an MRI and see, oh, that's the ligament, you don't have the same continuity in that image to be able to capture it unless you've got an amazing radiology tech who can get the exact slice through the ligament that you're looking at. And that's just, there's so much variation in the way the body is built, it's almost impossible for somebody to be able to do that.
Okay, so how would we know if the ligament's involved with that?
Yeah, that's a great question. So that's the process that we've evolved here. It's kind of the combination of what Dr. Escaloni does when he does biomechanical examinations of people to figure out what segments are really stable or unstable. And it's the combination of the pain mapping that I do where I'm actually, I can push on a limb and get a ballpark idea of, oh, okay, the pain is, something is broken down here because I'm pushing on it and it hurts. But I'm not going to be able to differentiate the 8 layers of tissue that are under there to figure out what it is. Well, with the pain mapping process, that's exactly what we're doing, is we're using the tip of the needle, a very, very tiny needle, and we're numbing as we go so that we can, once we get to the area that is really the problematic spot that's damaged, and anything damaged is going to have a higher sensitivity of pain. Once we get to that spot, then we're able to figure out, okay, that layer might not be working correctly. I can't tell you how many times I've done needle palpation or needle touches on the spine to figure out which specific ligament is intact and which isn't. And it's amazing. People have almost zero sensation of pain when a ligament is intact. You even get close to that ligament. You're not even touching the ligament, but you get close to that ligament that's damaged, and the person is already feeling abnormal sensations, which often radiate in a pathway that can mimic like a pinched nerve. So I've seen how many people are misdiagnosed with like a pinched nerve, where it's really a ligament or a tendon or a muscle that has been damaged and is sending off these signals that your body confuses as a pinched nerve.
So, okay.
That was dense.
Yeah,
I know,
so
that was a lot of information.
You could have somebody who's got pain that runs down their leg,
Yeah.
and they go and get an MRI, and they could have all these other things, but all it is a little ligament.
Well, if you think about it, what did I say at the beginning? That the first step is the ligaments losing their stability. So you get this slip and slide going on, and coinciding with that ligament damage is the disc. Now, which is the chicken and which is the egg? Meaning, is the pain coming from the disc or is the pain coming from the ligament? And if you just simply look at the MRI and make the assumption that the problem is the disc, well, every time if you have a hammer, everything looks like a nail. So if the disc is the only thing that you're attending to, then it makes sense we need to either fuse this so the disc doesn't keep degenerating, or we need to take out the damaged parts of that disc, both of which have downsides to them. Now, the alternative would be, what if we could restore the functionality of that original ligament? Like, wouldn't it be great to have an organic biological solution instead of metal and bolts and screws? That's exactly what we're doing with regenerative medicine, is rather than fusing the spine where it's no longer mobile with the rest of your body, it's no longer going to adjust to what else is going on in the body. It's a stagnant structure that everything else in the body, everything else in your spine has to accommodate. But if we were able to restore the functionality of those ligaments, if we were able to regenerate the outside of that jelly donut that a bite has been taken out of, if we're able to put that bite right back in there and seal it up, wouldn't it be great to have the same kind of organic movement that you were born with, but may have lost because of an injury that caused muscles to change, ligaments and structures around it to change, everything else has changed to accommodate that one injury, and it's just now snowballed out of control. If we can piecemeal all those things that have lost control back together, why do we need fusions?
Well, it sounds like you're talking like some Star Trek type stuff. That's like way too far in the future. We're talking about how do we help people now, though.
But James, we are helping people now. That technology exists. It's exactly what we're doing right now.
This whole time?
This whole time we've been doing this.
Oh, all right. Well, tell me more.
So essentially, that's what we want to do. Is I'm not saying fusions are bad. Fusions are necessary. There are situations in which there's nothing I can do to help that person. It has to be operated on. But I would say a vast majority of people who seek surgery as a solution have never even heard of regenerative therapies that can fortify the ligaments, that can restore the functionality of the disc. They've never done the rehab that could remobilize those segments that have lost their integrity and where your body is trying to compensate by using muscles instead of relying on the ligaments. They've never had the adjustments and the shifting and the exercises that can restore the functionality of all the structures that are meant to hold you up and allow you to kind of, walk like this. Those things are feasible. They're within our reach, but it's just that it hasn't gone mainstream. A lot of people don't know that these things are feasible because the mainstream of medicine has been wait till it's broken beyond repair and then operate on it, or numb it to the point where you keep damaging it, you keep injuring it more, allowing it to get to the point where nothing other than surgery is going to help. We want to move everything upstream so that we're seeing people before it gets to that unraveled state where there really are few options. We want to capture those people where surgery is not a necessity. It's something that can totally be avoided with some of these therapies.
So it sounds like if somebody has already had their back pain, then they should go to a place like Wellward, which does some amazing things like pain mapping, see our previous episode, or do stuff like PRP or stem cells, future episodes. But for those people who've already had the fusion,
right,
how does that help them? They've already had the surgery.
Yeah, so it's a great question. Why do people hurt after fusion? It's supposed to fix things. I can't tell you how many conversations I've had with insurers where they say, but the patient is fused. Why do you even want to do this procedure? Because that's a fused level. There's a lot of reasons people can continue to hurt afterwards, and it doesn't even have to do with the adjacent segment instability or the stress that's putting on the rest of the body. Just the fact of where they put the hardware, it's right on top of a nerve that goes to the joint. So a lot of patients feel pain, like the arthritic pain that they had beforehand, after surgery, even though that joint is no longer really relevant or there. And it's because that nerve can become irritated by the hardware that's there. The fact that there is hardware in there means that everything else is having to adjust. And if it's something that wasn't used to seeing that kind of a stress before, then it's going to break down and start to hurt. If they have to do a laminectomy, which is a whole different procedure, which we'll probably have to do a show about at some point, where if you've got stenosis and that area has tightened down and it is actually pinching a nerve or pinching the circulation to the nerve, then they go in and they remove that bone. But what are they leaving behind? A ton of scarring. And all of that scarring means that the nerve, which has to be able to elongate and shrink every time you move your limbs, that nerve, it's not like, if there was a wire going from here down to my toe and then I move my foot like that, well, that wire is going to have to shrink and expand. And if around that, where you've put in hardware or you've had to cut the muscles to get to that spot, if everywhere that nerve has to go has now been scarred, what's going to happen to that nerve? It doesn't have to be pinched anymore. It could just be tethered and being pulled through tissue every time you move, so that each of those tugs accumulates and it becomes just this lingering, persistent pain at the end of the day.
So it sounds like for these people who've had the lumbar fusion and they're still having that persistent pain, they need to see somebody who can listen very carefully to the back to hear what it's saying, to try to figure out where the pain's coming from, right?
That was really good, James.
I tried.
Yes, exactly right. We need to hear what the body is trying to convey with pain. Hear the message that the body's trying to convey with pain. which is part of our whole heal methodology. Hearing the message that your body's conveying with pain, envisioning what your life is meant to be, reconnecting with your identity, who you were meant to be, not who the pain defines you to be, alleviating the symptoms where, if that nerve is tethered, while we're figuring out how we can regenerate and repair around it, we want to provide some symptom relief. And then finally, leveraging healing, Heal, heal. Leveraging the way the body naturally heals in ways that it's not doing so. So, if a 2-year-old had the same injury as a 70-year-old, who do you think is going to do better?
Little guy.
Right, because they have stem cells literally everywhere in their body going, oh, here's a problem, let's fix it. Oh, here's a place we need to grow, let's grow. So the damage that happens at that age is almost instantaneously repaired and recreated. But at 70, you have fewer and fewer cells running around doing repair. It's kind of like you have a small house with 10 repairmen fixing it every day and building it up versus an entire apartment building with one lazy, sloppy repairman who's more preferential to his sloppy joes than repairing your toilet. That guy, there's just not enough of him. There are all these apartments that are crumbling, and he has to run around and fix everything. He's just not going to get there. But what if we were able to dig into the basement and discover there's a treasure trove of repairmen just kind of twiddling their thumbs, idle, waiting for something to happen. And we were like, hey guys, I'm going to give you a free evening of pizza if you get up there to apartment 2A and fix it. Just fix it today. That's exactly what we're doing, is we're leveraging what the body normally does to heal and concentrating it in one spot and saying, guys, go at it, fix this thing. Or ladies, go at it, fix this thing. And just getting all of that mass in one place.
Okay. So if somebody with a lumbar fusion with persistent pain, they need to figure out where that pain's coming from.
Right.
Then they need to have somebody who understands something like pain mapping to teach them what this means, make sure they're doing all the right things for their body to be taken care of while they figure out how to heal it, and then use the right things sounds like stem cells or something like PRP, or even something like prolotherapy could be used to help out that ligament or other pains around there to get back to normal again.
James, we don't even need to get that sophisticated. A lot of the times, these are very simple problems. Like there's just a tiny little scar in there where if we just put a standard injection in and inflate it, break up that scarring, and then get them to somebody like you who can do the manipulation, who can teach them the exercises to do, who can mobilize those muscles. Sometimes it's as easy as that. It doesn't even have to go into the sophisticated stuff of like PRP, prolotherapy, or stem cell-based therapies. These are not complicated problems once you start to understand it and look at it with the right lens. If we never discovered the microscope, we'd never know bacteria existed. This is the same thing. We've never looked at the body the way that we're trying to advocate medical society looking at the body. But if you start doing that, the solutions become readily available and they're not complicated. Yes, sometimes they are, but not always.
Okay. I think you've just given hope to a lot of people with what you just said. That's pretty cool.
If we do nothing at all, this show should be about hope. It should be breaking that whole mindset that I'm broken beyond repair and there is no hope for me other than the pain pills I'm on or other than waiting this out till surgery is unavoidable. That should be a thing of the past. We need to be inspiring people that there is a lot of healing capacity in the body. We just need to tap into it and understand better what is the cause or the breakdowns that cause pain.
Awesome.
Yeah.
I think that we've taught a lot of people a lot of cool stuff today.
Thank you. I'm glad to hear it. Hope so. And please comment. I mean, if we are giving you some good feedback or good information, we would love to hear that because you are our ambassadors. You get our message out. We are just like a squeak in the wind against the torrent of healthcare. It's a huge institution, and we need everybody's help in helping to educate and move this movement forward.
And if you want to hear anything in particular, a subject that we haven't talked about yet, let us know. Comment on the page. We'll look it up. We'll do the research for you. We like research. We're nerds.
Speak for yourself. Watch the way I walk. Well, that wraps up our show for today. Thank you for watching the 50 Shades of Pain show, where we examine the spectrum of shades that make up pain. Each patient is unique, and there are numerous factors that can contribute to your pain. In that spirit, we honor each patient as an individual and tailor a treatment plan specifically designed to optimize your health. Our WellWord team looks forward to partnering with you. I'm Dr. Donish.
And I'm Dr. Escaloni.
And we encourage you to start your healing journey at wellwordmed.com.
Thank you.
And this is the awkward part where I walk up and now I'm going to do this walk every time.
I'm just going to put my feet up.
That was really good.
I think we're
Oh, we're still shooting.